All right, 5:23 on your Monday morning. Welcome back. If you've ever felt like your dog can sense your mood, well, you might be right. A study in Mexico found dogs can actually read your mood through facial expressions and even distinguish between anger, sadness, and fear. The study's authors say the emotions seem to recognize that most humans is in happiness, but researchers say this doesn't mean dogs experience emotions in the same way humans do. Pediatricians are urging all children 6 months or older be vaccinated against the flu. The updated guidelines from the American Academy of Pediatrics come after a deadly flu season that led to nearly 200 children's death. Doctors say the flu vaccines have been thoroughly studied and are safe, but less than half of children in the U.S. are vaccinated. A recent CDC study found that vaccines can reduce the risk of children dying from the flu by about 80%. Where someone lives could influence the risk of dying from ovarian cancer. A University of Pittsburgh study showed that women who live in communities with more poverty and worse access to housing and transportation had a 20% higher risk of death after an ovarian cancer diagnosis. The study also found Black women have a 45% higher risk of death from ovarian cancer than white women. A common condition that affects millions of women in the U.S. is getting a new name this morning. Experts say they hope changing the name of polycystic ovary syndrome, or PCOS, will improve diagnosis and treatment over women. Bradley Blackburn explains.
Jaritza Dominguez was just a teen when doctors told her she might never be a mom.
That was very hard for me because I love children.
She was diagnosed with polycystic ovary syndrome, or PCOS, at 15.
I was having mood swings. I wasn't getting a period. I had a lot of facial hair growth.
For years, she struggled with symptoms which also included acne, weight loss, and fertility problems. So she started seeing Dr. Fatima Daoud Yilmaz at the Stony Brook Medicine PCOS Center.
This is much more than simply a gynecologic condition. This is a condition of the entire endocrine and metabolic system as well. So we see increased risks of prediabetes/diabetes, high blood pressure, abnormal cholesterol levels, sleep apnea, heart disease much earlier compared to the rest of the population.
More than 50 organizations have developed a new name for PCOS, now PMOS, or polyendocrine metabolic ovarian syndrome.
So it more accurately reflects the nature of the condition rather than simply making it seem like it's just another lady problem. So what I'm hoping is that this leads to not just a decrease in delayed diagnosis, but ultimately prolonged life expectancies for these patients.
Doctors told Jaritza that weight loss in combination with medications could treat her condition. She lost more than 75 pounds through surgery and 6 months later got pregnant with her daughter Michaela, now 2 years old.
It's the world. I'm loving each and every moment of it. It was a dream that came true, especially after being told that you wouldn't be able to.
She hopes more women get the care they need to stay healthy and happy. Bradley Blackburn, CBS News, New York.
Well, the name change for PCOS is a 14-year global collaboration between experts and patients.